Question that I got yesterday. Such a good question that, I would get in the clinic when I was working with patients in the clinic. And it's, when do you know when it's time to shift course? And I mean in the sense of, when it comes to your DeQuervain's, when it comes to your hand injury, your hand, thumb, wrist injury, when do you know to continue doing what you're doing, and when you should go ahead and jump ship, right? And such a good question. And, as a clinician, what I would say to my patients, and I'm going to say I interchange patients and clients. Clients is the new modern word to use for us rehab therapists. Honestly, I think it's a little ridiculous. I am used to saying patients. Patients to me is, it's a very positive word. It's a positive word representing a relationship between two people that I think has so much caring and love behind it. A patient is someone that a medical provider expert is taking care of, right? And the patient looks at the medical provider as someone that they can turn to for their problems, right? And so I think it's this wonderful relationship. So anyways, going back, so the patients that I would see, and actually, as you can see, I still get that question, is what I would tell them is usually at about 2 months, at that period, if you're seeing little to no progress, if you're seeing little to no change, that's when you should start really thinking about changing what you're doing. Okay. And I know, little is a very subjective word. It's hard to measure that, and I'm not saying that as you're doing your treatment program or whatever program you're following for your DeQuervain's pain, you shouldn't daily see these, huge leaps and bounds, or these, significant progress or medium progress, and getting better. It's going to be up and down. Okay, it's going to be a roller coaster ride. I'm sorry to say. You're going to have days where you're feeling like you're moving forward, and then days where, oh God, you're like, I am not going anywhere. I feel like I'm moving backwards. But in the grand picture, you should feel like you're moving forward. Okay, and oftentimes I'm, as a clinician, it's also my job to help the patients see that there is progress, right? And that's always a fun part of my job when, I have a patient who tells me, Rose, it's not going anywhere. And I take measurements and I remind them of what things were hard to do at their first visit. And I ask them now, is it easier? And they realize, it is, Rose, I can suddenly do this a little bit better. So it's actually a very exciting part of being a rehab therapist, an occupational therapist, being able to be in this part of my patient's journey. But anyways, if you're not overall, in the big picture, you're not seeing moving forward, that's basically the barometer of when you should shift gears. Okay. And like I said, or you know what? You also should trust your intuition. Okay. You should trust yourself. If you know deep down this is not working, you should definitely make sure that you are doing something different, that you are changing course. You're going to figure out something else to do. And I'm so sorry if I'm sounding just ridiculous right now. I actually am working off of very little sleep. My youngest woke up at 3 a.m. And yes, I'm the type of person, if you interrupt my sleep, I just am not able to go back to sleep. So like I said, if at about 2 months, that should be where you're starting to really reassess where you're at. positive or negative. If you're seeing, good change, definitely it's always a point to go ahead and see how you're doing. On a side note, when I'm working with my patients, I'm always changing the program, okay? Because you are getting better. So I'm going to progress your treatment program and your home program to make sure that we continue to progress you. But more importantly, if you're not seeing change, like I said, it's time to change the program, okay? And so when I'm working with my patients, what I'm usually telling them to do is I will go ahead and contact the doctor in some way and let them know, okay, this patient isn't showing the progress that we are hoping for, okay? Now, for you who might be questioning what I should be doing, if I've hit this point, the first thing I would actually go ahead and ask you is, are you making sure that you are as close to 100% following your home program, okay? Especially if it's given to you by your rehab therapist, a rehab therapist, or other medical expert. I want to make sure that you are giving this home program a good try, okay? But if after that, if after you've given it a good shot and you're not seeing progress, something else I would actually tell you to do before I advise you to go back and see your doctor is trying therapy again, but this time with an expert. I know this sounds so strange, right? Because you're probably saying, but Rose, I am seeing a physical therapist or an occupational therapist. They are the expert. Well, actually, PTs and OTs can be a further expert. Okay, so it's kind of like if you had heart problems and you saw your primary physician or your regular doctor, and you could see your regular doctor or you could see a cardiologist, right? So you could see your regular doctor who sees, someone with a heart condition on an irregular basis, or you can see a cardiologist who treats that every single day, right? So us rehab therapists who have this extra certification called a CHT or Certified Hand Therapist, that is a person who then specializes in treating hand, thumb, wrist, actually also forearm, elbow, and shoulder injuries. So I'm an OT, an occupational therapist who does have that extra specialty certification. And so I see injuries of the hand all the way up to the shoulder on a daily basis. Those are all my patients that I see. So I would recommend to someone who, like I said, is at that point in their recovery where they're not seeing improvements, I would recommend to them to find and see a OT or a PT with a CHT certification, okay? So if after that point they've gone ahead and tried a CHT and they're not seeing the improvements that they want and also their doctor is hoping for, or more importantly, that you want, then I would go ahead and start to discuss the other options after that, okay, which is a cortisone injection, also known as a steroid injection, or, or the DeQuervain's release. It's the surgery if you have DeQuervain's. So first, when it comes to the cortisone injection, so I'm always making sure that my patients know that my job is to 100% support you and your decision. So I'm not here to say what you should or shouldn't do. I'm here to inform you and educate you so that you can make the best decision for yourself, right? So I make sure that my patients know everything around a cortisone shot. Okay, so for a cortisone shot, it is a treatment that is fine for anyone. Okay, it is something that we say there's not really a contraindication. There's not, except for someone who has diabetes. And even with that, if you have diabetes, it's something that we should just be aware of. Your doctor and I need to be aware of, because it can throw off your sugar levels. But generally it is safe for everyone to use, to have, okay? Usually when you get a cortisone injection, how it goes is the doctor will numb the area first, right? And then we'll give you the injection. So usually at most you will feel just pressure to the area. With the numbing injection, that's where you'll feel a pinch. But then after that, with the steroid injection, it'll be maybe pressure. There is a few small percentage of people who might feel pain with the cortisone injection, but generally there is not pain with the cortisone injection, maybe pressure at the most. Now, things to know about the cortisone injection is there is a max that you should be getting, okay? And that's 3. Beyond that, there is a risk for a tendon rupture. Your tendons that are involved in DeQuervain's could break, okay? It weakens the tendons, so that the cortisone injection weakens the tendon. So there's a possibility of those tendons rupturing. But also, if you've hit 3 injections and it's not working, don't beat that dead horse, okay? Don't keep going. Something to keep in mind, and that's with any medical treatment, not just treatment for your hands, your injuries of your hand, thumb, or wrist. Any medical treatment isn't guaranteed, right? We don't know who will gain benefits from it and who won't, right? So with a cortisone injection, we don't know if that's going to be all you need for your pain to go away and be done. There is a small percentage of people where that's it, and their journey with DeQuervain's is done and over. More often, I'll see patients who get it and then have temporary relief, months, maybe up to a year, and then it comes back. And then there are those where the injection does absolutely nothing, okay? Something else to keep in mind too is usually it takes about 2 weeks max to get the full results of the cortisone injection. So if at about 2 weeks, whatever relief you get is the relief you will get, okay? But anyways, going back to the 3 different categories of what someone will experience post an injection. Like I said, we don't know who's going to end up, or I didn't say that. Sorry, 3 hours of sleep. We don't know who's going to end up in each category, right? We don't know if you're going to be the one that's all you need, or you have it and it helps temporarily, or it doesn't help at all. What us rehab therapists go in thinking is that, it might not help. It might not help on a long term, because we want to be, we want to equip you and prepare